In northeast Nigeria, more than 600,000 children are facing severe malnutrition, according to the Food and Agricultural Organization. Now, this is as a result of security challenges, poor feeding practices, and sanitary conditions, as well as the rising cost of food. TVC News On has more on this.
Betso, just like many villages in the Mubi North Local Council of Adamawa State, has witnessed some of the worst conflicts in the last decade. Residents are trying to move on with their lives, but relics of the Boko Haram invasion of Mubi in 2014 still abound.
Normalcy has returned to this community, but the village still bears the vestiges of the conflict, just like the tanks you see behind me.
The village head still has a fresh memory of the invasion.
317 houses were burned down by the insurgents. We all ran away. Some people hid in the farms while others went on the mountains. It was a terrible experience.
It's almost 7 years after the 2014 invasion, yet the impact is still felt in communities like this in the northeast.
Life is not exactly the same. The people have gone back to their stock and trade, which is farming, but poverty still stares them in the face.
The insurgency in parts of the region continues to affect livelihoods, deepen poverty, and limit access to food. On this day, Patience William brings her baby to the Betso Primary Healthcare Center to collect another ration of the ready-to-use therapeutic food. Her baby is among several malnourished children being treated at the center.
I have come a long way to get another ration of the therapeutic food. My baby was sick.
It's the same story at the General Hospital in Mubi, 30 kilometers from Betso. Malnourished children are being treated at the Stabilization Center with the support of International Committee of the Red Cross.
Insurgency is a problem. It comes with its own problem, and the worst problem insurgency causes is poverty. And what poverty brings in a community is malnutrition. So because of that, a lot of malnourished children and even adults they are suffering in the community. So IFRC did a survey and found out that there's a need for stabilization center to be established in this zone.
Basically, we stabilize children under 5, mostly under 5, who comes with complications of malnutrition. Most of them come in shock. That's not the complication. They come with generalized body swelling.
Ladi Moses is one of the mothers whose child is receiving treatment. Her 3-year-old son was diagnosed as suffering from kwashiorkor.
My child is sick. He is swelling. That's why I brought him here.
There are concerns that thousands of malnourished children in the northeast could die if they fail to get access to treatment like this.
Well, joining me via Zoom is communications specialist at International Committee of the Red Cross, Aliyu Dawobe. He will be talking to us about this development. Thank you so much for joining us on TVC Breakfast.
Thank you for inviting me. Good morning.
Yes, good morning. Now, the World Food Day was celebrated on Saturday. Can you paint us a picture of the deteriorating level in the northeast and north central with regards to the level of conflict around that region?
Thank you again. The International Committee of the Red Cross started work in Nigeria actually since 1988. And ever since, our mandate is to protect and assist people that are affected by conflict. You can see over a decade now, conflict has been going on in the northeast of Nigeria. This means a lot of people are going to be displaced and have already been displaced, over 2 million we are talking about. Because of this, a lot of people do not have access to lands, don't have access to health services, don't have access to so many basic things that they are supposed to have access to. This is something that is really very severe in the populations, civilian populations in the northeast of Nigeria. This is a very big concern to us. It has shown that this year, 2021, is one of the toughest years in terms of food shortages in the northeast of Nigeria, in terms of malnutrition and malnourishment to children and women that are pregnant, and also women that are breastfeeding. So this is really a very great concern to us. Of course, this is why we are trying to do our best, trying to support these families that are affected by this. This is what we are doing presently.
Talk to us more about what the ICRC is doing, because you've talked about millions of people displaced and don't have access to basic needs. In specific terms, tell us what the ICRC has been doing to address that.
Like mentioned, the mandate of the ICRC is protecting and assisting people that are affected by conflict. So whenever people are affected by conflict, this is actually a very big concern to the organization. This is a very big concern to us as humanitarian actors that are working there. So first thing we do is to try to provide them with basic needs. Basic needs can be water, can be medication, can be food, and so on and so forth. So we try to do this in the northeast of Nigeria. Specifically, we talk about malnutrition and the World Food Day. We are specifically talking about the support we give in prevention of this malnutrition. What we do is to try to improve the nutrition value of women and children that are possibly going to be affected by this, because we have seen this come in. So we have centers where we support women that are pregnant. In Borno State, we have about 5 centers. We have one in Monguno, we have one in Dikwa, we also have one in Damboa, and also in Biu, and also of course in Maiduguri town. If you come down to Adamawa State, also we have from the report you just saw, is a community health center in Betso, some kilometers away from Mubi. This is where we are also supporting people, children and women that are possibly going to be or are affected by malnutrition and food shortages because of the conflicts. Down to the north central states, we also have some centers in Guma, in Benue State, and also in Makurdi. So this is how we spread our centers. Of course, we also are doing our best. We don't have the resources to go around all the things, so we concentrate on the most vulnerable people that are affected, and this is why we are positioned in these areas. Of course, you can see that these areas I mentioned are actually areas that are critical in terms of conflicts and violence that is going on in Nigeria.
Speaking about the most vulnerable, how bad is the situation with women and children? We understand that many are undergoing severe and acute malnutrition due to lack of access to medication and good food.
Yeah, if we say that women and children are usually much more vulnerable because of their situation, especially pregnant women, they need much more food to eat, nutritional food. Children also need the same because they are growing, they will have to grow very fast. So they are the most vulnerable people. Sometimes adults are a little resilient in this regard. But then women, children are really the most vulnerable people, and that is why we are targeting them.
Now, most healthcare services have been destroyed and are no longer functioning due to the decade-long conflict. What is your take on this?
This is something of also big concern to the organization, because when you have conflict going on and then you don't have medical facilities available in the northeast of Nigeria, most of these are either destroyed or are no more functioning, or are epileptically functioning because of the conflict, either because healthcare workers are afraid to go there, or the communities are also afraid to go to this place. So basic health services to people is really a very, very great concern concern to us. When you talk about a population that is displaced, that is vulnerable or susceptible to malaria, diarrhea, vomiting, and then you don't have a midwife close by, a hospital close by to be able to provide basic things. This is really a very big concern to the organization, and this is why we position ourselves to see what support we can give in this regard.
Right. Now, malnutrition cases in the Northeast have also doubled compared to last year. How can this be tackled or reduced?
Usually, these cases come up because there are lean periods when between April and May, times where you have a lot of food shortages, and these cases of malnutrition go up. So we have seen the rising of these cases since 2019. We've seen yearly increase of malnourished people, children, women. 2020, we've seen also an additional increase. Perhaps because of the conflict going on, and of course also because of restriction related to COVID. This year we are also seeing a lot of over 50% increase from what we have seen last year. So this is really something that has to be looked at very critically, so that we will be able to see how we would support these vulnerable populations.
When you say looked at critically, what are the areas you are hoping is looked into?
For our organization, there are critical areas we look into. First, we talk about when people are displaced like this and don't have access, they really need a lot of things. First, they will need, of course, they will need food. The next thing, they will need also water. They will need medication, and of course, you can count a number of them now. So you can see food is critical to these people. Water is also critical. Medication is one of the key things so what we do is to mainly try to see how we can support them in this regard, and also keep working to see that they are also supported. Also, to talk about conflict affected people, you are also going to see a lot of people being separated with their families, a lot of traumatic situations. There are a couple of weeks back we celebrated the World Day of the Disappeared. This is also very worrisome to us, because Nigeria has a figure of over 24,000 people that are missing, that we are working closely to see that we reunite people with their families. Because looking at people that it's not just food, water, shelter and the rest of them, but also when they get separated from their loved ones, this is something that they also look at to see how they would be able to be supported to reunite with their loved ones.
Is the critical assessment of all of these issues that you have spoken about is this what led to the launch of the appeal fund that is about 4.1 million Swiss francs for 18 months of addressing this issue of hunger and poverty?
The IFRC, for now, I am not aware of any appeal made by the International Committee of the Red Cross. I know other movement partners. The Red Cross has movement partners. We have the International Committee of the Red Cross, which is mandated to support people that are affected by conflict and violence. And then you also have the International Federation of Red Cross and Red Crescent Societies, which is mandated to support people affected by natural disasters. And you also have the Nigerian Red Cross Society. So these are Red Cross families that work together, but the IFRC does not have, has not made any appeal that I'm aware of.
All right, we'll leave the conversation here now. Thank you so much, Communications Specialist, the International Community of the Red Cross, Aliyu Dawobe, for your time on the program.
Thank you for inviting me.